Welcome to the pre-application webinar for the Center for Coordination of Analytics, Science, Enhancement, and Logistics, or as we'll refer to it, in regulatory science. This is Tom Eisner speaking. I'm the Director of the Tobacco Regulatory Science Program. Just a few housekeeping issues before we get started. Note, I think when you registered for this, that everyone on the webinar, except for the presenters, are muted. You will, however, have an opportunity to ask questions by submitting them online in the Q&A chat box on the webinar website. Also, we will be recording this webinar, and the recording with the captioning as well as the slides will be posted on the TRIST website, as well as questions that are asked during the webinar and other ones that we've received, and we update those frequently asked questions every week, so you may want to check back on a weekly basis to see if there is additional information that you may have missed. Okay, well, I imagine that most of the people who are participating in today's webinar are already familiar with the Tobacco Regulatory Science Program at NIH, but I thought for those who may be new, I would just give a very brief overview of who we are before we get started with the actual RFA. So this program emerged as a result of a partnership between the FDA's Center for Tobacco Products and the NIH. The Office of Disease Prevention is where we're located, in the Office of the NIH Director, and they have oversight for this trans-agency, trans-NIH program. We serve as a primary liaison with the FDA and then coordinate all trans-NIH extramural and intramural collaborative activities involving CTP-funded research. I would like to always mention the fact that this is in addition to the NIH Tobacco Research Program. Most of you are probably familiar with the decades of research that the NIH institutes have been funding and continue to fund in tobacco control, and TRIST does not replace or diminish any of these existing research activities. So if you haven't already, to take a look at our website at prevention.nih.gov/tobacco. We update this on a regular basis, posting new opportunities, as well as portfolio of research that's been funded through CTP. So if you're interested in seeing the types of topics and research questions that are being addressed, you find all of that information on our website. So today we'll start with some background information on the FDA Center for Tobacco Products and the Tobacco Control Act by Dana Van Bemmel, and we'll be moving into the RFA, specifically hearing from Nick House, who's been a program official for this RFA, Buckle Up, who's the scientific review officer assigned to it, and also some financial and grants management issues by Amy Buckheimer at NIDA. After the presentations, as I mentioned before, you'll have an opportunity for a question and answer period. So I'm going to turn it over now to Dr. Dana Van Bemmel from CTP.
Great, Dawn. Good morning, everyone, and thanks for the opportunity to come and speak. I'm going to take the next 10 minutes or so to talk a little bit about the Tobacco Control Act just briefly, and then focus a little more on tobacco regulatory science, CTP's research priorities, and the types of research that are currently in our CTP-funded research program. Again, I think most of you on the call are probably familiar with the Tobacco Control Act. It was enacted in 2009, and since then, CTP has had the authority to regulate tobacco products intended for human consumption, including the regulation of the manufacture, marketing, and distribution of cigarettes, tobacco, roll-your-own, and smokeless tobacco. And this past August of 2016, the regulation went into effect that we refer to as deeming. So it deemed that all products meeting the statutory definition of tobacco products, including the components or parts, would be subject to FDA's tobacco product authorities. So that now extends to electronic devices, including e-cigarettes, e-cigars, vape pens, etc., all types of cigars, pipe tobacco, nicotine gels, water pipes, dissolvables that may not have already been or fallen under the TCA, and future tobacco products. So when we think about the activities that we do at CTP, much of it lies on what we call regulatory science, or refer to as regulatory science. And the Tobacco Control Act mandates, just to take a step back, that the tobacco product regulation it's regulated using a population health standard that takes into account both users and non-users of tobacco products. So as we do that and we think about the types of science we need to inform our regulatory activities, including reviews, developments of policies and regulations, this is the foundation and the public health standard that we are keeping in mind. It is slightly different than the safety and efficacy mission of many of the other centers with FDA. This is something that most on the phone are fairly familiar with. So the elements of the public health framework that we use include understanding the regulated products themselves, restricting product changes to protect public health, prohibit modified risk claims that state and imply reduced exposure or risk without an order, restrict marketing and distribution to protect public health, decrease harms of tobacco products, ensure industry compliance with FDA's regulations through education, inspections, and enforcement, educate the public about FDA's regulatory actions, and then expand the science base for regulatory action and evaluation. And it's that last bullet that we'll spend a little more time with, thinking about what we define as regulatory science and the types of research we're currently funding. So the question that comes up quite often, what exactly is regulatory science and how is that different than other science? And the answer is it's all science. When we think about regulatory science, we're talking about scientific inquiry or science that specifically can be used to inform potential regulatory decisions and actions to protect the public's health. So that's a very broad reach of science. Regulatory science involves the application of the best available science to specific regulatory questions. So as we're thinking about a product standard or a guidance, we're taking into account what we know and what's been published in the scientific literature. Regulatory research translates scientific knowledge into the specific scientific findings which serve as actionable information for regulatory decisions and actions. And to do this, tobacco regulatory science evaluates distinct situations to determine the effect on public health, which we touched on a couple of slides earlier. So again, regulatory science is really science that informs our regulatory activities at the Center for Tobacco Products. About the types of science that are needed to inform our actions, our regulatory actions, it's a very broad range of regulatory science. And quickly, those of you that are familiar with the Center for Tobacco Products will know that we have a very wide range of scientists that work within the Office of Science, which is where I'm housed at the Center for Tobacco Products. So it includes product scientists, including chemists, engineers, and microbiologists. It includes scientists who are thinking about the tobacco product user. So that would include exposure, toxicology, pharmacology, clinical medicine. Also includes our addiction branch and product use behaviors. And then again, considering the population as a whole, including epidemiologists, statisticians, and scientific evaluators. So we have this broad range of scientists within the Office of Science, and we use this broad range of science to inform our regulatory actions. Now I'd just like to take a couple of minutes to talk about the CTP-funded projects that have currently and were recently funded by CTP. CTP has 7 research priorities, including chemistry and engineering, knowledge, attitudes and behaviors, toxicity and carcinogenicity, health consequences, communication, marketing, economics, and policy. And as I'm looking at that, that's probably more than 7, but this is the list of current research priorities. I think we broke one out for this slide. When we look at our research portfolio, CTP has funded research through a number of collaborators that are both federal collaborators, including other centers of the FDA, CDC, and NIH, as well as contractors and other non-federal, non-HHS organizations. And we've listed just a few here on the slides to give a sense of who those groups are that currently or have just recently been part of our portfolio. Represents active CTP research projects by fiscal year, starting in the first year we funded research, which was fiscal year 2010, going through fiscal year 2015. We just completed fiscal year 16, but we're not quite ready to share those data yet. So this gives you a flavor of the types of research that have been funded and where we funded it. And you can see that the majority of our research has happened through the program that Helen described just a few moments ago, the Tobacco Regulatory Science Program here at NIH. But we also have a number of projects that have been funded through the FDA National Center for Toxicological Research, or NCTR, and then, of course, CDC, which is another federal partner outside of the FDA, as well as the green bar, which represents contracts and other mechanisms with other partners such as the defense. So the CTP-funded research broken out by projects by the big bucket categories that we talked about just a couple of slides before. In research that's been funded in addiction, you can see we have a number of research projects through several fiscal years that have focused on knowledge, attitudes, and behavior. But we also have research funded in the economics and policy, chemistry and engineering, communication, and then a fair amount in toxicity and carcinogenicity. So if you take this as a whole and you look at the numbers across the sphere, I think you can see that CTP is funding a broad range of research projects across a number of different research topics, from the basic bench science up to population science. So hopefully that gave you just a quick flavor of what the CTP research program and portfolio looks like. I just wanted to leave you with a reminder that there is a companion announcement for this particular CASEL RFA. It's for the TCORS. I didn't break it out in these slides, but we funded and intend to fund Tobacco Centers of Regulatory Science, which are large center-funded grants. And within the coordinating center, you'll see in this particular RFA, and the coordinating center that was funded, is currently still funded, there is a sub-piece looking at coordinating communication, logistics, scientific dissemination across the TCORS specifically. So I just wanted to point that out, that there's this companion announcement that you may want to take a look at, as well as the currently funded TCORS within the portfolio. I would encourage anyone interested in applying to this RFA to go, Helen mentioned, and look at the current research that TRISP is funding. And then I would also say, and I don't think that link was here in these slides, and it should have been, I apologize, that there is a CT research tool on our FDA website that will also allow you to take a look at the abstracts associated with these projects that were represented in the bar graphs earlier. So if you want to get a better sense of what's funded outside of the TRISP research program by FDA, specifically CTP. And I think that ends my slides. Maybe, sorry, my pointer isn't moving. My pointer. Yep, thank you. All right.
Okay, now we'll be hearing from Mary House.
Good morning, everybody. So yes, I'm going to be giving a brief overview of the FOA for the CASEL and highlighting some of the specific topic areas. You then can, of course, read in greater detail in the FOA itself. This particular mechanism is a cooperative agreement that means that the awardee would anticipate substantial NIH programmatic involvement during the performance of the activities for this FOA. Just wanted to put that there. And move forward with the purpose of this. Itself is to briefly, I'm going to say just briefly here, provide logistical support and coordination across research projects that have been funded by CTP, as you just heard from Dana, to conduct scientific synthesis and data integration, the career enhancement of tobacco regulatory scientists, and support dissemination of research results. And I'll go into those in a little more detail as follows. There we go. This slide lists the various components of CASEL, and all applicants must fulfill the main aspects for the proposed coordination center. And that's going to include an overall component, leadership, logistics, core, an analytics and synthesis core, a career core, decision core, and op cores may be proposed if fully justified. Bring those down a little bit further, get a little more information about those different cores. The leadership and logistics core, the main activities of this core are going to include what's listed here on the slide, and the top part of the slide shows you the general overview of what would be expected, convening 2 scientific meetings per year among TCORS grantees and or all of the CTP-funded researchers that, you know, again, heard from Dana about the different types and projects that are funded by CTP. To maintain a website for all this CTP-funded research. Coordinate and support CASEL and TCORS steering committees. Two different types of steering committees there that would require oversight. Now, TCORS are the bullets on the bottom part of this slide. So that would be coordinating activities such as the review process for the rapid response program, which is something needed in this program, in the TCORS program, and scientific working groups that come out of the TCORS. So that again, the expectation would be to coordinate those activities. On to the analytical and synthesis. As the name suggests, those would be the main goals, and it would facilitate collaborative research, provide methodological and analytic support. You want to provide a big picture overview of the funded research program to be able to help identify research needs, gaps, and opportunities for coordination, collaboration, and synthesis, and facilitate the use of consensus measures. These are common data elements that are useful to have across the different studies. And many examples of some of what the expected outcomes may be, and those could be found in detail in the FOA in Part 2, Section 1 of that under the objectives and scope. So I won't be going into details of that, but you can find those examples there. For the Career Enhancement Core, this should facilitate collaboration across the TCORS career enhancement activities to support continuing education in tobacco regulatory science among these grantees. You want to be able to create collegial and collaborative networks from the awardees at their various stages. So we have awardees that are participants that are at these various stages, whether they're new and early stage, whether they're trainees or they're mentors, but all of these categories are included. And it would include things like disseminating career enhancement modules and curricula, hosting web-based presentations, and organizing sessions at the investigator meetings and conferences. Now, the Dissemination Core must enable dissemination of research outcomes to appropriate audiences. That could be done in a number of ways, and some of these are listed here on this slide. Things such as scientific reports, seminars, conference presentations, collaborative manuscripts or themed journal issues, works and meetings. Again, there's a need for a development and maintaining of a website for CTP-funded investigators. To inform CTP-funded investigators of relevant issues, policies, and media information. So all of these types of things would be the type of things handled in the Dissemination Core for FISCAL. I heard a bit about the types of research areas that the CTP funds, and this is just an overview of the scope of some of those. Again, this is not that you would not be proposing these, but these are the types of areas that will be covered in the CTP funded research programs, and they are including these areas which you also heard from Dana, so I won't reiterate there. The projects under CASEL Purview, again, some of the greatest level of coordination and support would be, evaluating, coordinating, and supporting the TCORS, which is the companion RFA that you heard about, and most of you probably do know about. Items that are funded under the TRIS program, and you can find those listed, and there's a web link provided for you if you'd like to take a look at what all of those other funded programs are. Now, the evaluation and coordination and support could include other CTP-funded research and initiatives, and so the other agencies and organizations that Dana mentioned too. CDC contracts, work with the National Center for Toxicological Research, and other projects that are yet to be funded in the future. Just to briefly touch on the eligible applicants for this particular RFA. You can see listed here institutions and individuals receiving CTP or related NIH grants or contracts are eligible to apply. You may not request funding for activities that are already supported, though, by an ongoing and current active grant or contract, regardless of the funding source. In this particular case, foreign institutions are not eligible to apply, being non-domestic entities and non-domestic components of U.S. organizations. However, and you can see here, foreign components are allowed, so that is permissible. Note that key personnel of the CASEL awardee team cannot include key personnel from their team of a TCORS awardee, so note that distinction. Purposes of being able to better estimate the potential review workload and the plan for the review, it's very helpful for you to submit a letter of intent. And again, we can't require that, but we do strongly recommend this. And you can see the submission deadline for that is May 19th. In that, there's a listing of what we'd like to see there: descriptive title, name, institution, contact info for the ties, the name and institutions of other key personnel where that applies, the and title of this funding opportunity, and specific aims. And I know the FOA itself doesn't specify, but we actually really prefer and strongly encourage you to submit specific aims for this, and that can include specific aims, or should preferably include specific aims for the overall component as well as the individual course, just to give an idea of what you're proposing, and we can give you an idea if you're on the right track and before further developing your application. The letter of intent, as you can see there, is to be sent to the TRIS mailbox, and that mailbox link is there for you. you heard from Helen, and I'll reiterate here that the frequently asked questions is an excellent resource for you to check back and check back frequently, because they will be updated as individuals do submit their own questions. Feel free to check back with that as long as you'd like. And again, while non-responsive applications will not be reviewed, so we again strongly encourage you to be in touch. And I you know, as the program officer on this, encourage your contacting me to discuss your and questions and comments you prior to submitting something, so we can ensure that you are responsive indeed to the RFA and to the regulatory authority of CTP. And that's where I am.
Great. Thank you, Mary. So now we will move to of the peer review process with the SRO, Dr. Goldberg.
I'd like to touch upon a few issues which are important to keep in mind when you submit and prepare your application. Yes, applications due on July 19th, 2017. Study section meeting is planned on February 2018, and advisory council review on May 2018. As I said, applications are due on July 19th, and please keep in mind that a continuous submission doesn't apply for this RFA. If you are eligible for continuous submission, and normally you can submit your R1s or 21s almost any time you want, this doesn't apply for the current RFA. You will be eligible for 2 weeks late submission and 2 weeks window of consideration for late submission may be applicable to some other situations in addition to continuous submission eligible people. For examples may be death or severe illness of the PI, or a recent study section service of the PI. Recent, it means within 2 months before or after the deadline. However, keep in mind that no advance permission is given for late applications. It will be decided at the time of the submission whether or not a late submission request will be honored. But I should mention that recent study section service from experience have never been always is honored, so it's pretty safe. But problems with such reasons as problems with computer systems or system-to-system grant submission service will not be considered as excuses for late submission. Well, and important issue is that applications must be completed at the time of submission. No changes can be made after submissions. No errors can be corrected. And no post-submission supplemental materials may be accepted except for those which derive from unforeseen circumstances, such as death or severe illness of the investigator or departure of important investigator. In such cases, we can accept modified budget pages as a supplemental materials or by sketches, but basically nothing else which reflects the scientific content of the application, which should be changed or edited. And we can also accept a note of acceptance of a manuscript. However, any allowable post-submission materials must be submitted not later than 30 days prior to the meeting, and they must be submitted or approved in writing by your grant signed official. And it's useful to keep in mind that reviewers are not obligated to read post-submission materials. We do ask them to read, but they are not obligated, and sometimes it's not impractical because when we have 2-stage review, we send applications to the reviewers 4 months before the meeting, 3-4 months before meeting, so review may be well completed by the time when supplemental materials are submitted. We make all efforts to avoid any real or perceived conflicts. You may be aware of some of the conflicts which we are not aware of, that may be personal conflicts or long-standing scientific differences. If you have any potential conflicts of that nature, please do indicate those in your cover letter when you submit your application. So when your application comes, I could evaluate your request and take appropriate actions if they are necessary. And please do not wait until the roster is published or 1 or 2 months before this, because it may be way too late to do anything about this. To exclude from the review anyone involved in any of the applications, including consultants and people from tobacco industry. From the review of any particular application, we will exclude all collaborators, current collaborators, or all former collaborators within the last 3 years, or anyone involved in that application, including consultants. We exclude also mentors or mentees, consultants forever, of anybody involved in your application. If you have collaborators from 10 different institutions, from all those 10 institutions will be allowed to review your application. So it's very easy to build up an all-star team which nobody can review. Well, and score review criteria which we will use on the search is the same as used for all NIH applications: sequence, investigator, innovation, approach, and environment. However, some of these criteria, in particular significance and innovations, are tailored to the purpose of this RFA. And specifically, when the reviewers will evaluate significance, they will ask the question, how will successful completion of the aims affect the concepts, assets, and technologies related to the manufacture, distribution, and marketing of tobacco products. And when they will evaluate innovation, they will ask the question, does the application challenge and seek to shift research in the field of tobacco science as it relates to the manufacture, distribution, and marketing of tobacco products, and whether it will advance our knowledge base that informs the manufacture, distribution, and marketing of tobacco products in order to protect public health. And we will make all efforts to train our reviewers to provide them appropriate guidance to make sure that they will follow exactly instructions as they are written in the RFA. So it will be very useful if the application will be written in a way that would help reviewers evaluate these aspects of your application. There will be, in addition to scored review criteria, there will be additional review criteria for this RFA. These are not given individual scores, will be considered in the review and will influence the overall evaluation of your application. These additional review criteria are designed to evaluate leadership and logistic core, and synthesis core, career enhancement core, and dissemination core. And specifically, review criteria for leadership and logistics core include organizational structure, leadership and managerial capacity, plans for communication and cooperation, core lead, leadership and managerial and management of logistics support, and plans for facilitation. And when evaluating analysis and synthesis scores, the reviewers will pay attention to the commitment of facilitation of the use of standardized measures and collaborative activities, capacity to coordinate analysis, and plan for identifying research gaps and opportunities. And for the career enhancement core, they will evaluate career enhancement leadership, plan for career enhancement coordination, capacity to develop and implement career enhancement experiences. And evaluating decision core, they will focus on the expertise in disseminating research findings to appropriate audiences. And in addition to those RFA-specific criteria, the reviewers will be asked to evaluate standard aspects of all NIH applications, including protection for human subjects, library animals, biohazards, resource sharing plans, and authentication of key biological and chemical resources. So these important components of the application and protection for human subjects and vertebrate animals may influence the overall evaluation of your application, and overall impact score which will be assigned to your application. Well, I touch upon a few applicable policies, and on only a few aspects of those policies. So do not consider that as a full description, and there are many more questions you may probably have. And if you have any questions, please feel free to contact me anytime by email or by telephone number, and my contact information is in the RFA and also on the screen. Thank you.
Thank you, Boris. And now the final presentation will be from Amy Buckheimer, the Grants Management Specialist, who will be handling this FOA.
Can you
hear you in the room?
Oh, good. Okay. Good morning, everybody. I'm basically just going to be going over Section 2 of the RFA, just to point out some specific budgetary information. NIH intends to fund one application, and the total cost can be up to $2 million. Those are total costs, so we would need to make adjustments to come in at that $2 million total cost mark. You can request a project period of up to 5 years. Ray Couch pointed out, and I'd like to note again, foreign or entities and non-domestic components are not eligible to apply. However, foreign components are allowable. And I'd like to point out some dates that have been mentioned, but I'll underscore those again. It's not required, but the letter of intent, if you intend to submit one, should be received by May 19th, 2016. The application due date is 5 p.m. Eastern Standard Time on July 19th, 2017, and earliest possible start date could be early as July 2018. Awards will include a special term requiring a separate interim progress report at the 6-month portion of each budget year. And another reminder, FDA awards don't have carryover authority. This U54 award wouldn't have otherwise. Because it is FDA funded, I want to underscore that they have carryover authority. Therefore, a approval request should be submitted for situations where there is a bona fide need. And if there are any questions or concerns, I know that was very quick, you can certainly call or email me, and my contact information is listed here for you.
Thank you. I point out one other change that I have noticed since we've been mentioning the TCORS opportunity announcement. That RFA was reissued on Friday because of an omission. Actually, when it got published, it was missing some information, not just the significant text for the view criteria. So it was reissued on Friday. The basic content is still the same. It's just includes some text that's missing. That number has changed. So instead of RFA OD 17003, it's now 006. Okay, it's exactly the same. So just wanted to point that out to any confusion when you see a different number. So now we're going to open it up for our question and answer period. And as I mentioned, again, you can type in your questions. So the first one is, what is the relationship between the prospective CASEL and the already funded Center for Evaluation and Coordination of Training and Research? Mary, you want me to go ahead and answer that? Okay. So, yes, a good question. And the TCORS, which really is the centerpiece of the CTP funded research program at NIH, when that was funded, didn't have a coordinating center, and the current coordinating center now, sector, funded a year after those grants being active, and it really, they had a lot of catch up to do. It was not the best way to implement the program. Rather, we want a coordination center that coincides with the funding of the TCORS. And so to avoid that problem again, we are issuing CASEL as the generation of the sector. Now, there will be a year of overlap, but on the other hand, sector is focused on the current cohort of as well as other grants. And when CASEL comes into, they'll be working with new cohort. Presumably, some of those awardees will be some of the same, but they'll be doing different work, and there may be differences in the program. So CASEL is really meant to take up the baton when as to the next cohort of TCORS grantees. Obviously, have some coordination between the two. Next question. Please send us all the slides shown. Well, you find them on our webinar, so we're not going to be sending them out to individuals. You'll be able to download them from the website. The webinar be archived for later viewing, and will the slides be posted? Yes. As I mentioned earlier, in addition to the slides, there will be a recording with closed captioning that you can listen to if you so desire. Let's see, I think that's it for the questions. We'll wait another minute or two to see if anyone else has a question. Again, if you think of something after the webinar that you would like to ask your questions to the TRIS mailbox, we'll answer them and I'll post them, the question and the answer on our frequently asked questions so that the answer can be shared with all applicants. Okay, well, I guess everybody got the information they needed. So I think this concludes the webinar, and we look forward to hearing from